A stroke, it happens in a flash. It's a sudden, totally life-altering medical emergency that honestly waits for no one. Understanding what's happening and what to do isn't just a good idea, it can literally save a life. Okay, so let's dive right into this and break down exactly what you need to know. Wow, that quote, it just hits you, doesn't it? It perfectly captures the terrifying reality of a stroke. It strikes without any warning, and in just a few moments, absolutely everything can change. I mean, just imagine that. A loved one is perfectly fine one second, and the next, they can't even get a word out. It's just a stark reminder that this can happen to anyone at any time. All right, so to really get a handle on what a stroke is, we first have to understand the opponent. And often it's the result of years of hidden damage, a silent enemy that's been building its forces long before it ever decides to attack. So what is a stroke really? Well, at its most basic, it's a brain attack. It's a really good way to think about it, just like a heart attack, but it's happening in the brain. That crucial flow of blood carrying all the oxygen and nutrients gets cut off. And get this, the brain is so hungry for that oxygen that without it, you can lose almost 2 million brain cells every single minute. It's staggering. And that's why you'll hear it again and again. Time is everything. Okay, so not all strokes are the same. They basically fall into two main camps. On one side, you have the ischemic stroke. The best analogy is a plumbing blockage. A blood clot gets jammed in an artery, and boom, everything grinds to a halt. This is by far the most common type. Then on the other side, you've got the hemorrhagic stroke. This is the opposite problem. It's a burst pipe. A blood vessel actually ruptures, and blood starts spilling into the brain tissue. Both are obviously huge emergencies, but you can see why doctors have to treat them in completely different ways. So you're probably wondering, okay, what causes these clogs and bursts in the first place? Well, it's usually not one single thing. It's a whole mix of factors that have been building up, sometimes for decades. You can see the usual suspects right here. Things like smoking, high cholesterol, an unhealthy diet. All of this stuff contributes to the slow, gradual hardening and narrowing of our arteries, basically setting the stage for that one catastrophic event. But if we had to point to the number one public enemy in this whole story, it's this one right here. High blood pressure. Seriously, the reason it's so incredibly dangerous is that you usually don't even feel it. There are no symptoms. But behind the scenes, that constant elevated pressure is just hammering away at your artery walls, day in and day out, making them weak and brittle. It's a ticking time bomb. Okay, so we've talked about the silent buildup. Now, let's switch gears to the moment it all goes wrong. The sudden, loud alarm bells that you absolutely positively need to recognize. Honestly, what we're about to cover, it's the most powerful tool you have. All right, everyone, listen up, because this is probably the most important thing we'll talk about today. These are the universal warning signs, and there's a simple acronym to help you remember them. FAST. First, F is for face. Ask the person to give you a big smile. Does one side of their face droop down? Then A is for arms. Ask them to raise both of their arms. Does one arm drift downwards on its own? Next up, S for speech. Have them repeat a simple phrase, like the sky is blue. Is their speech slurred or strange? And if you see any of those signs, you get to T for time. It's time to call for help, immediately. No hesitation. And here's the key thing I really want you to take away from this. You do not need to see all three signs. Not at all. Just one is enough. A drooping face, all by itself, that's an emergency. A weak arm, that's an emergency. Slurred speech, you guessed it, it's an emergency. Please don't ever wait to see if it gets worse. Okay, but what about this tricky situation? What if these signs appear, but then a few minutes later they just vanish? The person seems totally fine again. It's so easy to just breathe a huge sigh of relief and think, phew, false alarm, right? But is the danger really over? No, absolutely not. Not even close. What you've likely just witnessed is something called a TIA, or a mini stroke. Think of it as a stroke where the blockage cleared itself. But you have to see this for what it is, a massive, flashing red light warning. It is the brain's final warning shot, screaming that a much bigger permanent stroke could be just around the corner. This is a get to the hospital right now moment. And that brings us right into the most critical part of this story. From the second those symptoms start and that call for help is made, the countdown begins. We are now officially in a race against time. Remember how we said time is brain? Well, this is exactly what we mean. Look at this timeline. For an ischemic stroke, that clogged pipe version, there's a powerful clot-busting medicine that can work wonders. But, and this is a huge but, it has to be given within a window of about 4.5 hours from when the symptoms first started. Every single minute that passes, more brain cells are lost forever. So how did doctors fight back? They have two main weapons for an ischemic stroke. First is thrombolysis. That's the clot-busting drug, usually given through an IV that just goes in and dissolves the blockage. But for bigger clots, they have something that sounds like it's straight out of science fiction, a thrombectomy. Doctors can actually thread a tiny catheter through your blood vessels, guide it all the way up into the brain, and physically pull the clot out. It's absolutely incredible technology. So after the immediate crisis is over and the patient is stable, a whole new journey begins. It's a challenging, but it's also a very hopeful path back to life. And nobody walks that path alone. Recovery is a total team sport. You've got physical therapists helping to rebuild strength and movement. You have occupational therapists who help relearn all those daily activities we take for granted, like dressing or eating. Speech therapy is so crucial for helping people find their voice again. And just as important is psychological support to help manage the huge emotional toll a stroke takes. And the ultimate goal of recovery goes way beyond just getting back what was lost. The real mission is to make sure this never, ever happens again. It's called secondary prevention, and it means aggressively managing all those risk factors we saw earlier, like blood pressure and diet, to protect the brain for the future. So, we've covered what a stroke is, what causes it, and how to spot it. The information is no longer a mystery. So the only question left is this. Now that you have this knowledge, are you ready to act? Because the next life you save could be that of a stranger, a friend, or someone you love.